bridge the gap between veterinary medicine and public education, ensuring those that are on the front lines feel supported and informed. Amber is committed to strengthening the human-animal bond and improving animal welfare. So welcome, Amber.
Can everybody hear me? Do I need to stand really close to this?
You need to stand really close because the people in the back can't.
I'm going to make a lot of ridiculous faces just so we're clear. I will definitely do this instead. Okay, so there is a ton of information in this. My slides are super wordy, and I will try to push through it. Feel free to take pictures of the slides. I did that on purpose with the amount of content that's on them so that you can just take pictures so that you don't have to. I'll start yelling. I'm sorry.
And this will also be posted on our website.
Great. Okay, so this will also be posted on their website as well, so let me figure out where I'm at here with this shenanigans. Okay, so this is just a statement. I'm not going to go over it too much, but as a licensed veterinary technician, I cannot give you specific medical advice. I cannot give you drug dosaging. I'm going to cover some stuff that I may not be able to answer questions on. Feel free to ask your questions, and if I can't give you further information, I will just tell you so. Okay, so the point of this is I want you guys to be able to feel confident when injuries are presenting at the shelter or on the road or whatever it is that we're doing, so that we can confidently kind of go through and deal with those things before they go to a vet clinic, so that we can try to get them in an appropriate situation before they get to the vet, so that we're handling things to get them the best possible outcome.
You're whispering again.
Yeah, you got to eat that mic. Sorry. There you go.
Okay, so listen, I'm going to take my shoes off. Things are getting weird. I've already decided. Yes. Okay,
Love
so the first thing we need to do when we get to a scene, if there's an injury, we can't just collect the animal, is we have to assess that scene to make sure that we are not going to get injured, trying to make sure that we are containing an animal to take it to our shelter centers, whatever. So the first thing that we do when you're taking an assessment of that patient, if they are down, if they are injured, is airway, breathing, circulation. It is the same in human medicine. It is the same for every species. Make sure they are breathing, make sure their heart is beating. If it is not, we will then cover some things to do. Anytime that you're handling an animal, you want to make sure to handle them confidently, quietly, because if you are stressed out, they are going to pick up that stress. It will make them more stressed. If you're, joggling them around while you're trying to pick them up, it's going to create some issues. There's a whole bunch of stuff on this slide. These are emergency situations. These happen in the field. They happen in the shelter environment. They are things that need to see a vet. They cannot wait. I'm not going to go through the slide because I feel like a lot of this is common sense, but if you need to take a picture, feel free to do so. Something that I want you guys to do, if you haven't already, is you want to try to have a protocol for triage on what you're going to do in a situation, something that's written down, laminated, hung to where everybody in that center can know how to approach a situation. This is just an example that I pulled from the internet. The source is down in the corner. There are so many ways to do this. Find a way that works best for your center shelter situation. This is going to be your normal TPRs. I put initials next to things just so that you know if you don't already use those. These are how we quantify these words into little acronyms in vet medicine. So ideally, your patient's going to be bright, alert, responsive, which is indicated as BAR on their files. QAR is quiet, alert, responsive. Those are going to be more fearful, sick type patients. Mucous membranes, the normal color of those is going to be pink, like cooked shrimp. You want to see those nice and pink. Obviously, some patients are going to have pigmentation on their gums. Totally normal, totally fine. Just figure out if there's a pink spot, and if you can't see one, you can check the conjunctiva of the eye. You can check inside of the vulva. You can check inside of the prepuce. So there's several different places that you can check. If there's a place that you can physically touch without it causing discomfort, that's where your capillary refill time is going to come in. So if you press on your fingernail and you see how quickly the blood returns to that, that is your capillary refill time. You want that to be less than 2 seconds. Any longer than that tells you that their perfusion, their blood perfusion is not great. So that indicates something is going wrong there. Temperatures, cats and dogs are pretty much the same. This says 100 to 102.5. In practice, I would say 99.5 to 102.5, perfectly acceptable. Obviously, temperatures spike. All of these vitals spike when something is stressed out. So you can get like the little brachycephalic pug trying to get a nail trim or trying to get restrained for vaccination that spikes a 104 fever just because it's panting and struggling and getting crazy. So you do have to be mindful of those things. Taking a pulse for a cat is a lot of fun. Most of the time you can just kind of cradle them in your hand, feel both sides of the chest. Try not to use your thumb so much just because you have a pulse in your thumb. You will pick up on your pulse sometimes. So do your best. You're primarily palpating with these fingers, but your thumb will kind of hold it in. So under stress, it can get upwards of 200, maybe even 250. If it is too fast to count, you need to try to reassess when they're more calm. But you want to see that ideally around 120, definitely below 200. So if things are too chaotic, just try to reassess when things are more calm. Small dogs, medium, large dogs, puppies, those all are a little bit different simply because the younger the animal, the faster their heart's gonna beat. The larger the heart is, the slower it's going to beat. So it can range anywhere from 60 to 160, but it just really depends on the size of the dog, the size of the heart. Respirations, for cats, we're looking at 20 to 30 breaths per minute. Dogs, 10 to 30 breaths per minute. Obviously, panting does not count. Cats do not pant. If you see a cat open mouth breathing, it is super stressed out or in respiratory distress. You need to put it in a calm, quiet environment, let it chill out, and try to reassess once it's calmed down. If it does not, that means immediate medical intervention. And when you stress those cats out that are in respiratory distress, they can very quickly go into cardiac arrest. So just be very mindful. If you pick a cat out that's breathing like crazy and it falls over or goes unconscious, that's not a good thing, but it happens. When in doubt, just always give it a second and reassess. Now, for emergency kits, again, we talked about having protocols, but as far as kits go, I think everybody should have a kit. If you're working in a shelter or animal control officer out in the field, you should have a kit available. There are so many kits available online. Feel free to find one that works for you. Something that I do like in my pet first aid kit is I like to have a nylon slip leash because you can use it for muzzles. You can use it to capture animals, obviously. You can use it for restraint sometimes to kind of hog tie something. Obviously, that is a last case resort. You do not want to do that for fear-free sakes, but just make sure that you have everything that you need, regularly check it and replenish it. And then this is some stuff that you want to have in your kits. So you want to have your basic first aid supplies. Obviously, that's going to be like gauze pads, non-stick, bandage dressings, vet wrap because it's self-adhesive. You can have some first aid or adhesive tape. You want blunt-tipped scissors, just so that you're not accidentally stabbing something if you are trying to bandage, a wily dog that's been hit on the road or something. You want sterile saline solutions, so you can flush wounds, eyes, whatever, and then some tweezers. You do want to get a quick read digital thermometer. My favorite one is the Vicks Flexi Tip. Reads in 7 seconds, is amazing. And then for an ear thermometer, the Braun ear thermometers are the only ones that I actually trust. Any of the other ones I've tried are not accurate. What I will say about an ear thermometer is you have to be careful because if you have a dog or cat that has been in the environment and it's too hot or it's too cold outside and you bring them inside and you try to take their temperature, those ears don't have a lot of vascularization in there, not a lot of large blood vessels. The temperature outside will absolutely affect the temperature of that animal that you're reading out of that ear. So one thing is, good night. One thing is that thermometer reads off of the eardrum, the tympanic membrane. So you have to put it in and tip it forward ever so slightly while extending that ear canal. So as long as you're doing it properly and you make sure that animal has been sitting in the room temperature kind of environment and things are allowed to kind of either heat up or cool down, you should be able to get an accurate temperature, or at least relatively accurate. If you're ever in doubt, compare them, do a rectal and an ear thermometer attempt and just see which one, you know, hits the most accurately for you. As far as stabilization and transport aids, I have a blanket, I have a thick blanket in my car. You can either do things like blankets, they have cloth gurneys that you can buy that have handles on them. I bought one on Amazon for like $11. You can use boards, you can do all sorts of stuff, but I keep a blanket in mine just because it's less intrusive on my actual vehicle. And then as far as muzzles, if you are going to keep muzzles, they need to be obviously many, many different sizes if you're keeping in your vehicle. So for this purpose, I like to, in my vehicle, keep just gauze, or like I said, those slip-ons. Because very quickly, you can grab them, and if you can't get a muzzle on them, you can always throw that thick blanket over, and that helps you to be able to pick them up without getting injured. And then emergency medications, this is if you have a vet on staff or a vet that you work with and you're able to get protocols for certain drugs. Those are things I would also keep in my kit. For transporting injured animals, we kind of already talked about the stretchers, all that stuff, but here's an image up in the top corner that kind of shows you how you would use either that gauze or, hell, I've even used a shoestring. You can use all sorts of stuff, but something secure that's not just gonna break, but you basically just do an O loop and then you do the same thing behind the ears and give it a little, you know, tie, however you need to do it, but something that's quick release. And then you never put any kind of muzzle on an animal that is having trouble breathing or that is vomiting. Or brachycephalics, I wouldn't even bother. Most of the time you can hold them pretty still with a blanket over by both sides of their head. And then avoid jostling them if they are injured, just because if they have a broken limb or an injured spine, that dog is likely to come at you. That cat they can still rally even when they're hurt really badly. And then always, if you're taking them to the vet and it's possible, please call them ahead of time so they can be prepared for you. There are many different slides on here with all sorts of different possibilities. So I will kind of gloss over them. If you have questions at the end, feel free to make me, since this is the last session of the day. We do have bleeding and deep wounds. You're not generally worrying too much about your superficial wounds, so like your scrapes, abrasions, clean it up, shave it if you have to. The deeper wounds where we have things like profuse bleeding, you think it needs closure, it needs repaired in some way. If it actively happens in front of you and you have active bleeding, you're going to use clean, sterile gauze, or if nothing else is available, a clean cloth, and you're going to put firm, steady pressure on that wound. You never peel off that first layer to check the wound, ever, if it's bleeding profusely. Leave it on, because that first piece becomes like the clot, right? So if it is bleeding through, you're piling more on top until you get to the vet and they can actually do things like ligating vessels or cauterizing or whatever. If you can, if it's a limb, or even like a head, you want to elevate. So if you can, you're going to kind of tilt them up, or if it is a limb, kind of elevate that just because it slows the blood flow to that specific area, hopefully slowing the blood. And then if you need to, you can do a pressure bandage. You're going to wrap it pretty tight, though remember if you're using vet wrap, that tightens down on itself more the longer that it's on. So just make sure that you're not doing it too tightly, and never, you always want to wrap down like distal to proximal. You're never going proximal to distal, because what you're doing then is you're pushing fluid and circulation down to the bottom. You're going to get swelling everywhere below it. So you want to wrap from the bottom to the top, make sure that you're watching toes and things like that, because you can cut off circulation pretty easily. For severe bleeding, and I use this very, very cautiously. You can apply a tourniquet. However, be aware that if you're using a tourniquet and you're not getting immediate vet treatment, there is the possibility of losing that limb, or digit, or whatever it is, so just keep that in mind. And we're not using peroxide on deep wounds anymore. Use saline to flush them. Peroxide is actually causing cellular death on both healthy and dead cells. So we have to be careful with using peroxide. And if you do have to use it ever, usually we're diluting it. It's usually like a 1 to 10 ratio with sterile water or saline. For fractures, of course, we're going to try to minimize the movement of the injured area. Do not attempt to reduce a fracture or a dislocation. You can cause serious injury to yourself and to the pet. If you do have a broken limb and you have to take it somewhere, of course, try to support the limb gently. If you can splint it, I've used pool noodles, I've used popsicle sticks. There's all sorts of stuff that you can easily just grab in your environment to try to stabilize both sides of the limb. If you are dealing with a fracture, say I'm fractured here mid-femur, you're going to support below and above that. So you would need support on both sides that would extend both sides past that fracture, because we don't want those bones moving. Now with fractures, especially on those large bones, shock can happen very, very, very quickly. Definitely muzzle these guys, because if you move them just right and they get a big jolt of pain, they are going to assume you are the one that caused it and they will come at you. Burns, there are all sorts of different types of burns. We can get thermal, electrical, chemical burns. I think we all know first, second, third degree burns. The first thing that you want to do if you have a burn is flush it. And we're using cold or cool water, not cold water. Room temperature water is fine if that's all you can get to. If you have sterile saline, great. If you don't, water, it will be fine. Chemical burns, you want to rinse for longer. You need to do that for about 15 minutes, sometimes longer, depending on what the chemical is. You should have MSDS sheets accessible for all chemicals that you are using in your environment. So you need to have a binder that has its material safety data sheets. So every time you order new chemicals or supplies in, medications, chemicals will all have those sheets with them, usually with the shipping invoice. Put those in a binder, because you want to keep an eye on that, because if somebody gets it in their eyes, if somebody accidentally spilled it on the floor, whatever the case is, it will tell you exactly how to handle what happens there so that you're doing the appropriate thing and not causing further damage to yourself or to others. And then if you have to get them transported, you can cover the burns with very loose, non-adherent dressings. I would even potentially consider something like a t-shirt, like a real loose t-shirt. Obviously, if the burn is deep enough and oozing enough, it can still stick to it, but a t-shirt's gonna be nice and loose, and if you're using it just to transport, that will work. And then again, just try to make sure that you're being very calm when you're dealing with this, because it is very, very painful when you have burns of any kind. And then again, these guys are at a huge risk for shock. Oh, I love what happened there. So heat stroke. Obviously, this is going to be more prevalent in our brachiocephalic breeds. Something that I have to say, after being in the clinic for as long as I have and working in a rural area, people don't understand that even though they have outdoor dogs and they provided shelter and they've provided water, if it is 80 degrees outside and it gets too hot, that dog is not gonna think, I should go dunk myself in that tub of water. It just doesn't happen. And they're not always gonna go move to shade. They often will just hang out, and even shade isn't always cool enough. So you will see a lot of heat stroke, at least I do in the clinic, and I'm sure you guys do as well. If you get early signs, which most people are not going to recognize early signs of heat stroke because it just looks like they're hot. They're panting excessively, they're drooling, they're restless, and their mucous membranes are really bright, like almost red bright. The more red that mucous membranes get, obviously the more blood flow, but if they get really red, that starts to mean that they're getting like toxic. So really red mucous membranes are never a great thing. There's always something going on that's causing that. More severe signs of heat stroke are going to be GI, vomiting, diarrhea, and then we start getting neurologic symptoms. We start getting weakness, collapse, seizures, and being unresponsive. When you find a heat stroke patient, you're going to move them to a cool shaded area. If you can get them inside, great. If you can get them in a vehicle with air conditioning, great. If they are awake, you can offer small amounts of water, but I'm talking small amounts of water, and you let them keep it down for a little bit and then offer more. That's going to be kind of passively cooling them. Do not force them to drink water, because some of them will get so hot that their brain will not allow them to swallow. I have a phrase that I don't use in front of most people, but if their temperature gets high enough, it can scramble the eggs. So things just will not function the same way anymore. So you have to be careful with that. And then we're cooling them gradually. It is not a quick process. You will put them into shock. You are going to wet their fur with lukewarm water, not cold water, and you are using fans. We are not wetting towels. We are not throwing wet things over them, because that then acts like an insulator and will trap all of their body heat against them. They will not cool down. Rubbing alcohol, not using that either. That used to be a big thing. We don't do that anymore. The reason we don't use rubbing alcohol is because it is a vasoconstrictor, which means the blood vessels are going to get real small, less blood's going through it, you're not cooling anything down. And then if it's bad enough, it can cause organ failure. So that always needs a vet. Hypothermia is exactly the opposite. They get real cold. Mild, I think, is pretty obvious. Moderate, you're going to start seeing weakening, pulse, confusion, muscle stiffness. When it's severe, their pulse is going to continue to slow. Think of it like, when you start to see these guys, they almost look like they're sleepy. They're real sleepy, or they're real lethargic, right? And it's just because their body temperature is low enough that everything is slowing down. So when it gets bad enough, they can become unconscious. The blood's not flowing right, so they can definitely have cardiac arrest. When you see these patients, you want to move them to a warm, dry area. These guys, you want to wrap in blankets. You can use warming devices. However, we are not using direct heat sources. You can use warm water bottles wrapped in something. You do not ever want whatever your heat source is to sit directly against your patient. I use a lot of rice socks in practice, a lot, but still always having a barrier between them, because those can get really, really hot. And then most of these guys need resuscitation in some form, usually IV fluids and 24-hour monitoring, so you'll want to take them in as well. If they are wet, dry them. Please dry them. For seizures, I'm not going to cover this a lot, just because most of the time they need medical care. Is it emergency? Not always. A lot of the times it can be. It just depends. Have they gotten into something? Are they super tiny and possibly hypoglycemic? Because that happens a lot, especially when we have real tiny little toy breeds that we have in a shelter when somebody's not watching them 24/7. Maybe it didn't eat great the night before. You come in the next morning and that thing looks like it is half dead. But it's just because its blood sugar's too low. So have things like Caro syrup around. Honey can work, but Caro syrup is more concentrated. It is far better. NutriCal also works, but the thing to know about any of these aids is it's like a candy bar, okay? It's gonna spike their blood sugar, but then it's gonna fall. So you have to get them eating as soon as you can for those hypoglycemics. That still should be evaluated just to make sure there's not something worse happening. But it's a pretty easy way to find out if that's what it is, because they'll pop right back up within 20, 30 minutes after getting that Caro syrup. And if they're so down that you cannot get them to eat it, you start rubbing it on gums. Okay? Not so much that it's gonna slop up in their mouth and you're running out, but you're constantly taking a dabber and rubbing it on their gums until they start to become more alert and can eat on their own. Seizures, the big thing to take away from this is if you have a seizure that is lasting more than 5 minutes, let's say 5 minutes or longer, that's an emergency. Okay? Anything shorter than that should be evaluated, sure, but it is not a crisis right this second. Okay? The other time that this becomes an emergency is if they have cluster seizures, which is where there is no resting period between those seizures, because then their temperature is going to start to rise if they're getting clusters, and it will fry their brain. There's a lot of things that can cause seizures, though, toxins, hypoglycemia, all sorts of stuff. So, choking, this is how you perform the Heimlich maneuver in dogs. For small dogs and cats, primarily you're doing that like you would an infant. So you're laying them down your forearm, head towards your hand, and you're doing back thrusts, okay? And if you have to, if you can't get it to go the other way, you can do abdominal thrusts like this. You're not pushing up, we're gonna break a xiphoid process on the ribs, okay? And that can puncture a lung. We're taking the abdomen, and we're taking our fist, and we are forcing it straight up into the abdomen. This is not foolproof, not always gonna work for one. You can cause other damage for two. But the alternative is they've now choked to death if we haven't tried anything. So we're only doing this if they're unconscious, or not necessarily unconscious. If there's a visible threat to their airway, you know that you can try to pop it out. But if they have one unconscious or they stop breathing, that's where we move into CPR and actually life-saving stuff. I have slides on CPR. I'm not going to dive into that really deeply, though. I do teach a certification class for that. You guys can book me for it. The information for that will be on the last slide, which I then dive more into this first aid stuff and the CPR stuff as well. But there is, all of the information will be on the upcoming slides on how to do compressions and all of that. So, if you have a dog pawing at the mouth, or a cat pawing at the mouth, gagging, retching, you can assume that there's probably something in their mouth obstructing the airway. Not always, though. Please don't go fishing around in mouths, especially on cats, because anytime cats have respiratory infections, dental infections, a lot of this stuff can cause this drooly, weird mouth type stuff in cats. Heart disease can also kind of cause the retching, coughing, kind of weird stuff in cats. You can see it in dogs, but cats, that is their primary first onset of that disease. So when you're looking at gums, if you notice the color is blue, that's cyanotic, just means blue. That means that they have really poor perfusion, right? So the blood is moving, potentially, but it's not getting anywhere fast enough to give oxygen back to those cells. So then, if we don't return that perfusion, they will start to have cell death. And then after you have dislodged anything, if you do have a choking patient, it needs evaluated because it can cause all sorts of strictures in the throat. They can have inflammation enough to actually cause swelling of their trachea as well. And sometimes they can put enough pressure on both the trachea and the esophagus to cause all sorts of issues up here with both swallowing and breathing. Toxin exposure is probably one of the most common things that happen. There's a lot of things that can cause toxin exposure, right? We can eat it, we can come into contact with it, just physically touching it, breathing it in. Most of the time, these animals are ingesting something when they're at homes or on the street or in yards. So just recognize that all of these things can be signs of it, though they can be signs of so many other things. But you will see the GI stuff, vomiting, diarrhea, drooling, potentially. Usually those are ingested chemicals or medications. For neurologic, you're going to get tremors, seizures, and lethargy. Sometimes you can get something called ataxia, which is where they kind of bumble drunkenly, walk around. That usually comes before the seizures. So if you start to notice that, that is your indication that something neurologic is starting to kick off, whether that is a true disease process or a toxin ingestion situation. You do get a lot of this with cats in particular, with topical flea prevention. So, don't do that. For the Hearts and Sergeants brand products, if I'm being honest, have been the ones that I've seen the most have this issue in cats. And people, I think, don't realize as much that you have to make sure that it is an appropriate product for each species. A lot of people try to use flea and tick prevention on their cats that was made for a small dog, and a lot of the over-the-counter stuff is not safe like that. There are tick preventions for cats that are available that are usually prescription, but that's for another day. You can get cardiac and respiratory issues with toxin exposure and ingestion. That will cause irregular heartbeats or difficulty breathing. Again, you can notice issues with their mucous membranes. Depending on what it is, sometimes you'll get excessive thirst or urination. I don't think you're probably gonna pick up on that one and think toxin ingestion. There's so many other possibilities there. But anything that causes either a pollutant in the body or inflammation, infection, whatever that pollution is, your body will start to take in more water to try to dilute that out, okay? And then here are a couple of the top poison control hotlines. Just know that these always have a charge. It may be less for shelter workers, you have to ask them. I do think that they give vet professionals a discount, but you'll just have to ask if and when you ever need it, that if they do provide a discount. But something to know about for this is that if you start a case, this company will follow until the end. So if this happens, you take it to your vet and you say, hey, this is what they got into. And you know, you want to provide like the ingredients and the percentages and all those things, because all of that matters. But poison control will often then talk to the vet's office, tell them exactly what they need to do if they don't already know. And then they'll also provide information if you have to go to emergency, they'll talk to them. And if you have any follow-up, they will then be involved in that as well. So that payment right off the top includes a lot of different steps. Again, I'm not going to dive into this terribly, just because I think we all know when CPR probably needs to be done. And the reason I'm not going to dive into it too much is because you only have like a 1 in 4 success rate if you do institute CPR. Yes, it's something that should be done if you find an unconscious, you know, an animal without a pulse or a respiratory rate. However, you have to know that if you go into this, that it's not always going to be successful. And that's not your fault. Here are some of the things that you're going to want to know. There are different hand positions for each size of the animal. This is all publicly available information if you search it on the internet. You want to look for the Recover Initiative. BLS is basic life support, but it will show you pictures and it will give you all of this same information. You are shooting for 100 to 120 compressions per minute. Your compression depth will always be 1/3 to 1/2 of the chest width, and you need to allow for the chest to fully recoil before the next compression. We do mouth to snout breaths. When you do mouth to snout breaths, you pull that tongue all the way out, you close the mouth, you elongate their head and neck. You want to make sure that they're kind of all in a straight line, and you're usually to their back, so you're extending their head up towards you, and then you stick your mouth and seal it around their nose, because you're holding their mouth shut and you're going around their nose. That's how we give mouth to snout breaths. They do have barriers for these, though it looks like a plastic bag, so whatever you guys want to do there. I have put my mouth on many noses. Yes, gross. So you want each breath that you're giving to cause that chest to rise for approximately 1 second. The thing to know about canine and feline cardiac arrest happens for different reasons than it does for people. They don't have heart attacks because they have coronary artery disease, okay? They have heart attacks usually because the blood-brain barrier is so sensitive to gas exchange in the brain that if it gets off balance, their breathing will shut down. Their heart shuts down shortly after that, okay? So when that happens, usually it's because they can't get enough oxygen in, and they'll stop breathing, and then they'll arrest. People usually, it's their heart first, so they take a big before they fall over. So something we need to realize with them is they need oxygen as soon as possible. You do these compressions for about 2 minutes straight. You don't want to take a pause. If you can have 2 people, that is always going to be better because you want the breaths about every 6 seconds. It's hard to do by yourself. Here are several different resources. Most of these are on first aid. There's a lot of available resources out there from different veterinary, clinics and research partners and all sorts of stuff. The Recover Initiative, though, is a great place to find CPR information. And then there is the information for, if that QR code doesn't scan, I do have business cards, but is there anything I didn't cover that you guys want to know how to address? Anything that you see frequently that you don't know how to deal with? Yes?
When a dog chews something and swallows it immediately, is there something different to break it up?
Okay,
Depending on what it is.
professional opinion. No. So, okay, if it is a toy or a foreign object, hopefully your vet has given you a protocol on what to do and how to handle that. If you work with one for medications, drugs, whatever, have them tell you, because yes, there is. But there are things that we don't like to give, and it depends on what the product is that they've ingested on whether or not you can induce vomiting. We don't like to use peroxide for that either, but say you're out in the middle of nowhere and that's the only choice you have, that's your prerogative. You know? I'm not gonna tell you it's cool. Have I done it? Yes, I have. Yes, I absolutely have. Those ratios are online too. I'd love to give that to you, but I cannot. Yes,
Does the human voice control not answer questions related to animals?
most of the time, no. Most of the time they will say, sorry, can't do it.
I have a question. So about, or like community resources, if I was working with somebody, how much money would it cost to follow the animal poison control? About.
Every poison control costs a different amount. Those numbers are pretty easily accessible online, but they change every year. Last I looked, I wanna say it was like maybe $70. It's expensive. It's not